and as a people, two extremely different groups of voices seem to have merged as we continue to face COVID-19. There's one side that believes we should lock everything down until we have a vaccine. There's also another side that's vocal, that just thinks that we should not, that we should just go back to normal, ignore social distancing, ignore masks and other precautions. Neither of these positions are sustainable or realistic. On the one hand, the economic pain and health-related issues resulting from another lockdown are not something we can put up with, nor will the people accept. On the other hand, anyone that thinks this virus is not a real threat or that we don't need to wear masks or social distance needs to understand that the community spread is real and that this virus has severely impacted the lives of many people in our country. 2 weeks ago, I could only name a couple of people that I had heard of that had COVID-19. Today, I can name many. In fact, I'm in hospitalizations are up and ICU percentages are down related to COVID-19. Many healthy people that get it experience an incredibly difficult time. And even if this virus is not effective, seriously, you can pass it to them with a compromised immune system that can threaten their life. If they did, we wouldn't be in the middle of this crisis. But here's what I do know. Those of us in leadership positions, those of us that run cities and counties, need people to understand that we must learn to live with this virus until we get a vaccine. To suggest otherwise is disrupting things in recent months. Many seniors who missed their graduation, missed prom, no track and field, no ballet, no piano, no sports, no theater.
Sorry for the technical difficulties, everybody. As you know, Mayor Curry is in self-quarantine after being exposed to someone with COVID-19 and is having difficulty connecting from his house. We're going to go ahead and bring in our Chief of Staff, Jordan Elsbury, who is going to continue with some important information about new testing facilities that are going to be opening next week. Jordan?
Yeah, thank you, Nikki, and thank you, Mayor. Sorry again for the technical difficulties. I'll just jump right into the numbers. With us on the call today, we have Under Sheriff Pat Ivey from JSO, Fire Chief Keith Powers, and Emergency Operations Center Director Steve Woodard. As of this morning, the Florida Department of Health reports an additional 744 COVID-19 cases in Duval County, 74 deaths, and an overall positive testing percentage of 8.9%. Our hospitals are reporting a total of 460 current hospitalization of COVID patients, 82 in ICU. As we talked about on Tuesday, while we are seeing more COVID-19 related hospitalizations than we did in April, the percentage of those hospitalizations requiring ICU care is lower. As it relates to new testing, earlier this week, we talked about the new federally supported testing sites that will be opening July 15th. Today, I'm announcing that 4 of 6 new city-funded coronavirus testing sites will come online next week. These testing sites will be in Arlington, Mandarin, Regency, and the Beaches communities, and will be operated in partnership with Telescope Health, Optum Health, and the state of Florida. One of these locations will open at 7 a.m. Monday morning at Jim Fortuna Senior Center, 11751 McCormick Rd. This location will be open Monday through Wednesday weekly over the next 6 months from 7 a.m. to 3 p.m. Currently, with the additional of the 3 temporary federal sites that open Wednesday, we can test close to 5,000 people per day. By adding these additional city-funded sites, we continue to expand testing capacity to better help us in identifying and isolating positive individuals to stop the spread of the virus. Simply put, the more data we have, the more people that get tested, the better. With a more representative sample, we have a more accurate understanding of how this virus is spreading and affecting our community. This will assist greatly in stopping the spread. Watch our social media channels and look for a new conference early next week for more details on the new testing facilities. You can also visit our testing information webpage on the city's website, www.coj.net/COVID-19 testing for more information. With that, I want to offer a few reminders. I want to remind everyone watching that it is our personal decisions that will make the difference in how this virus affects our lives. Because people can be carriers of the virus with no knowledge or symptoms, it is very important that everyone take preventative measures. Wear a mask, wash your hands, keep a distance of at least 6 feet. Again, I want to thank you for joining us today, for those who helped get important and accurate information to the people of Jacksonville. With that, we'll go to questions.
Thank you, Chief of Staff Elsbury. It looks like Mayor Curry was able to get a good connection and is back on the call, so he will be with us for the question and answer period. Our first question comes from Jim with News for Jax. Jim? Jim, can you hit unmute, please? Can't hear you. Can you hit unmute? Can you hit unmute, please, Jim?
Again, do you hear me now okay?
We do hear you now. Thank you. If you could start from the beginning.
Sure. This is for the mayor, and I'm wondering if he's had a chance to respond to the council president's memo regarding the RNC and the request for the cost that it's going to do for security and for masks. And then a question for the undersheriff. Undersheriff, I know you had commented on the security before, the zones around there, and what businesses downtown are going to need to know about the RNC.
Hey, Jim, my staff, I've seen the letter, my staff.
We apologize again for the continued technical issues. Jordan, can you please pick up and answer that question for Jim?
I can. Thank you, Mayor. Jim, yes, we've seen the letter from Council President Hazuri, and as we've done with all of his colleagues throughout this process, we continue to answer questions. Our staff is currently evaluating and answering all of those questions currently, and we'll have him an answer or several answers shortly.
But no answer yet? I mean, nothing on that yet?
Jim, as you saw, if you had the document, there were several questions there. So there are multiple departments involved in answering those questions, as well as some with JSO, some with ASM Global. So there's an effort amongst the entire city to really get those questions, but we'll provide them shortly.
Jim's second question was for Undersheriff Pat Ivy. Undersheriff Ivy.
Yeah, Jim, good afternoon. So in the planning process, any businesses that will be affected, and I'm sure there will be several, there will be communication between us and them, or the city and them, in regards to any compliance issues and what our plan is moving forward.
The next question is from AG with Florida Politics. AG. AG, go ahead, please. AG, we'll come back to you. We're not able to hear you. Our next question is from Lorena at Action News. Lorena.
Hi, thank you. Good afternoon. Okay, so we're seeing rollbacks in other parts of the state. For example, in Dade County, the mayor there rolled back the reopening of restaurants and other businesses in an effort to stop the spread. Is that a possibility for Jacksonville? If not, Mayor, in your view, what would need to happen for you to consider rolling back reopening? And also, I'd like to squeeze this question in as well. We've heard from at least 2 hospitals that while they're okay now with PPE, they're concerned that because they're seeing more patients, it's running out at a faster rate. What is the city doing to get them more PPE? And when was the last time that the city provided PPE for the hospitals?
Yeah, to answer the first question, there are no plans currently to roll back. We're operating at capacity levels that are under statewide executive orders. And I believe that we can operate that way responsibly if people wear masks and practice social distancing. I am in regular communication with hospitals as it relates to their ability to handle the COVID patient load. And while raw numbers of COVID patients are up significantly because community spread is real, they're able to handle that. ICUs as a percentage of those patients are not as high as they were back in the March, April timeframe. A focus is, can our hospitals handle this? That's what I'm continually asking, and at this point they tell me they can. Is Director Woodard on the call at EOC to talk about PPE equipment?
I am, Mr. Mayor, thank you. Yeah, we continue to work with the state and the Department of Health for PPE. We've distributed almost 2 million pieces during COVID-19. When we get those requests from hospitals or other facilities, we work with the state and the Department of Health to fill them. As far as at this point, we have no unmet needs. Thank you.
Let me, as it relates to shutdowns and lockdowns, I know when my opening remarks, I don't know how much came across because of technical difficulties, but it is important that we understand it's incumbent upon us to recognize and to share with people that we've got to learn to live with this virus. Continual lockdowns are not sustainable. They're not healthy on many fronts, economically and personal health. And frankly, people won't stand for it at this point. So we need to learn to live with it. We need to recognize how this has disrupted the lives of our children. We talked a lot about that when the shutdown started and seniors were missing graduation and the prom and all the things that come with their senior year. Young people have, for months now, missed everything that is part of being a young person. Whether it's the arts that they practice, dance, piano, sporting events, track and field, baseball, football, you name it. It's incumbent upon us to be responsible as leaders, as cities and counties, to figure out how to navigate this in a healthy way, but also in a way that understands that the continual disruption of our children's lives, these lives are just not acceptable.
Thank you, Mayor. Mike from the Daily Record.
Yes, hello, Mayor. Two questions, both in regard to the RNC. First, how far is the committee into negotiations with ASM Global and other entities in moving the RNC to an outdoor venue? Would that alleviate any concerns you may have about mass COVID-19 transmission at the convention? And the second question, in regards to the recent lawsuit that was filed by downtown business owners, stating that they think the RNC is a health nuisance. If COVID-19 cases continue to rise in Duval County and statewide, when would the decision be made that it's just too much of a health risk to have a mass gathering in Duval County that's prohibited by the governor's executive orders?
I'll let Jordan take the first part of the question in a moment, but let me say that, as you know, we're at 50% capacity right now. We're monitoring the spread in our community every day. I saw news cycles that I believe it was Houston pulled their statewide convention. Okay, yeah, they pulled it a week out. They monitored the situation up until the point where they could make a decision. We are monitoring the situation. So these daily questions about what's going to happen, the answer remains the same. We're monitoring the situation, and we're going to act in the best interest of public health when we get to it. The other thing I would say as it relates to the lawsuit, in any number of that lawsuit and letters that I've received over the last week, there are people associated with a number of these things that I know personally. Not a single one of them has yet to pick up the phone to have a conversation. It's communication via paper. We take it seriously, though, and we're going to work with people. Jordan, you want to answer the first part of the question?
Sure. Thank you, Mayor. Mike, one thing important to note, all of those facilities in the entertainment district were flagged by the using agency from the beginning as possible sites where they would host events or conduct business. So that's not new. The idea of moving it from the arena to the stadium is obviously one that they're considering, but I think they'd been considering doing a number of outdoor events anyway. Look forward to seeing what the host committee comes up with ASM Global. As for contract negotiations, the city hasn't been a part of a contract negotiation yet. They're working directly with the host committee and ASM Global for contracted facilities, as they do with every event. So we'll continue to monitor that and update as we have more information.
AG with Florida Politics.
Hey, thank you. Take two. Mayor Curry, quick question for you about the New York Times report that Governor DeSantis is freezing out fundraising for the convention based on Susie Wiles. Is that report accurate? And a second question, there are rumors that the source of that report is from the mayor's office. I wanted you to address that also. Is there a problem fundraising? Is the governor actually putting the kibosh on it? Let me know. Thank you.
Yeah, thanks. To the second part of the question, no, I can't imagine the source would be anywhere around my office. And the first part of the question, I don't believe that. The first I heard of that was reading it in the New York Times. I work with the governor and his team on any number of issues, particularly we have been on COVID. We've talked about, obviously we've talked about the convention. And I think, I don't believe that there's any truth to that story.
Haley with First Coast News.
Hey, Mayor. There are still lots of unanswered questions about the RNC, including basic stuff like where it'll be held and apparently some troubles fundraising. As co-chair of the host committee, how much of your time is spent working on RNC versus other issues in our community right now? And then two, what are the metrics you are watching to determine whether to ask the RNC to move to a different city? And within those metrics, what are the target numbers and dates?
As a co-chair of the host committee, basically make a handful of phone calls and ask for private fundraising dollars. So it's not a huge investment of time. As it relates to, I think the question was asked just a few minutes ago. We're watching everyday hospitalizations. We're watching community spread. There's not one thing you look at. You could have widespread community spread with very low mortality rates and very low hospitalizations. What we have right now is widespread community spread. Hospital admissions are up significantly. ICUs as a percentage of those are not up. They're not anywhere near the percentages they were back in March and April. If we have widespread community spread and ICUs are full and hospitals can't handle it, obviously as we begin to head that way in consultation with healthcare experts, we would take action at that time.
Thank you, everybody, for joining us today. We do apologize again for the technical difficulties. We will get these connectivity issues figured out before we join you again next week. Hope everybody has a great weekend. Thank you.